3, 2, 1, action! My name's Beverly and I am a genuine Trafford resident, and what I'd like to ask Joanne Harding is, I would like to know about your role, a typical day or a couple of days in the life of yourself and the job you do.
Well, that's a great question to start with. So, I guess to explain a little bit about me and my role, really. So, I'm a councillor in Trafford and I represent the ward of Urmston, where I live. But as well as being a councillor, I'm very lucky to hold the executive cabinet member for adult social care. And that's something that matters greatly to me because I've worked across social care for years. So I feel very privileged to have that role. So no 2 days are the same, and certainly with the global pandemic thrown in the middle, I really had to hit the ground running around some of our social care meetings. So ordinarily I'd have about 3 to 4 meetings a day around social care. I will meet different community groups, coming out doing things like this. I love just meeting people in the community. I might then have more formal meetings. So for example, if there's an exec meeting or a full council meeting, they happen in the evening. So I don't have a 9 to 5 job, I would say. Aside from that, I'm a mum. I've got a daughter, Grace, who's nearly 18, who is neither girl nor woman, but thinks she's a woman. So I've got the challenges of that. I've got a dog, I've got to walk the dog. And I also work as well. So I've always worked full-time being a councillor. So I do work with other local governments and local authorities, just supporting people in politics and health. So no 2 days are the same, but that's how I like it.
Jo, can you tell us what adult social care is, please?
Okay, so each council has what's called a statutory duty to provide care for people that need it. And that means we assess people if they need varying degrees of care. So that might mean some people need medication, some people might need food, some people might need more personal care. But it's a big portfolio, so it's the biggest spend in the council. It's the biggest budget. I manage a £60 million budget. It's the biggest workforce. It's the most challenging, but involved in that is, so it will be older people's care homes, learning disability and mental health, substance misuse, so drugs and alcohol, care in the community and some community work. So it's really varied, but it's a big, challenging portfolio.
I would be interested to find out a bit about your work with the Age Well Board.
Yeah, so under my role as the exec member for adult social care, I chair the Age Well Board. And the Age Well Board sets its priorities for how people age well in Trafford. So we will look at things like falls, frailty, dementia, end of life care, older people's housing. It's how people stay well for the rest of their lives in Trafford. And actually, one of the things I like about the board is that it involves everyday people who live in Trafford, who become our eyes and ears in Trafford and tell us what's good and bad about Trafford and how they manage to age and what we need to change. So yes, it's a really interesting board.
Hi Joanne, my name is Doretta. I'm also a Trafford resident and I have a couple of questions I want to ask you, so thank you very much for willing to answer them for us. The first question is, what support is available to Trafford residents who are facing the rising living costs?
Yeah, a great question, and a really worrying and scary time for a lot of people at the minute, across all ages really. And I think we've noticed that certainly that cost of living crisis is impacting on everybody. From an older people's point of view, one of the things we know in Trafford is that a lot of older people don't actually claim the benefits that they're entitled to. So what we're doing as part of the Greater Manchester collective, each local authority has an Age Well lead. We are doing a big campaign across the spring which will encourage older people to think about what they might be eligible for, really. Now, a lot of older people sometimes think, if I own my own house, I'm not eligible for anything. If I've got a private pension, I'm not eligible. They also might be put off by form filling or the stigma of being on benefits, and they might think, I just can't be bothered. what we're trying to do is break down those barriers and say, we will help you if it's about filling forms in, but actually you could be entitled to an awful lot of things.
How can Trafford residents find out about the support that is available within the community?
One of the things that we mustn't take for granted is that everybody is connected digitally. So you could say to somebody, oh, just go online and find this form. If you aren't online, if you don't have a smartphone, if you don't have a laptop, how can you possibly go online to find out these things? So what we're going to try and do is use other partners in our communities. So, for example, police work with a lot of vulnerable people. The fire service, they do safe and well checks. Local libraries, community centres such as this, we're going to encourage other people to have that conversation and say, you know, do you claim your pension credits? Do you know you might be entitled to a warmer home supplement? You might be able to get help with your dental care or your glasses. There's so many things that people probably don't know about, and we need to raise awareness of these things.
Thank you very much. Excuse me. Another question is, we look at the areas of Trafford, and Trafford is quite a large borough, a very large borough. So you come from all the way from Hale Barnes all the way down to Old Trafford itself, coming into Stretford. The areas are very different, some are quite affluent. I mean, how are they going to sort of like balance that out to make sure that everybody has the same availability of things available to them?
Yeah, absolutely right. And funnily enough, I met somebody this morning who described Trafford as a tale of two cities. I kind of quite liked the way it was described, because Trafford from the outside is seen as a very affluent borough, because it has areas of great wealth and affluence. However, that also masks quite a few things. If you look at the big houses in Hale and Bowden, you get older people living in fuel poverty. They might be asset rich with a big house, but they're struggling to pay the bills, so they tend to live in one room in a house. So don't let that be an indication that because we think people live in Hale that they're cash rich. They might not be. There are massive health inequalities across Trafford in the wards such as Clifford, Gorse Hill and Stretford. The healthy life expectancy, people living in ill health, it's really stark. So it's our job as councillors and officers and partners in Trafford to make sure that we raise that all the time and say, don't let it seem just because we've got a lot of wealth in Trafford that everybody is benefiting from that, because they aren't.
You're obviously very passionate about the communities you work in, and I am too. So how and what advice would you give to someone like me who wanted to become a councillor?
Great. Come and meet me for a coffee. I will tell you the things you need to do. So I guess the first thing I would say is this. I am all about getting more women involved in politics. We've just had International Women's Day, Break the Bias. We absolutely have to do that. And women need to feel that they can do. So what I say to particularly men who are in politics, no, she can do it and she will do it. It's not a man's world. And I think for me, it's about women believing they can. My daughter was only tiny when I became a councillor. The guilt I felt when I had council meetings at night when she'd phone me and go, "Mummy, come home." But I knew that I was actually role modelling a positive mum for her. So the first thing you need to do is be a member of a political party, unless of course you want to stand as an independent. Then just become very active in your community. There is always something you can campaign on. I led a massive campaign when I was first elected on the Save Trafford General. The services were changing and it was a huge campaign that culminated with 1,000 people marching through the streets of Trafford. And we didn't win that fight, but I was incredibly proud of that community campaign. There's always something that you will feel passionate about in your community. Go out there, fight for it, do it, get people alongside with you and put yourself forward and be loud and get allies, get other women to champion your cause too.
Hi Joanne, it's only me, Heather. There's a few questions to ask you regarding what can people do to get through struggling to see the GPs?
Well, I'll give you an example. I've got a live example. So this morning I wanted to speak to my GP and they asked my GP, again going online, you go on at 8:30, at 8:34 it was closed. And I thought, that's ridiculous, how on earth? So I called the surgery and they said, we've had a very busy weekend. I said, I'm sure, and I don't want to lay any blame at your door. I understand lots of people are wanting to see their GP. From a kind of formal point of view, we've got Health Watch, that are an organisation in Trafford that put forward the voices of patients and the public. And if you are experiencing difficulty accessing your particular GP, then I would contact Health Watch. If it's a GP in this area, I could formally take that up as well.
Right.
But I think there's a universal thing that lots of people are struggling to get face to face. GPs are trying to get back to normal, but what worries me is that people leave things because they think they're too busy, I don't want to mither them. You must never leave things. If you have a symptom that's worrying you, don't ever leave it, just push and push to get seen.
And the next question before I do the other question, how did it end up coming to this scenario, like basically saying, well, people have to phone in? You know, like before you used to phone, get an appointment. How come it all just changed and just gone really downhill?
I think that was in response to the pandemic, really, that the face-to-face appointments had to change. From an infection control point of view, GPs did not want to put anybody at risk, particularly older and people living with illnesses. They didn't want them putting themselves at risk. So there was a change. Now don't get me wrong, some of the Ask My GP can be really positive. You know, you can get an answer. I just needed some medication reviewing. It was done within 15 minutes. I didn't need to go to the surgery. So it does work in some cases, but I don't think in others it works, because when you actually sit in a room with somebody, particularly with mental health issues as well, you actually need to read people's body language and you need to see how they present. You wouldn't necessarily get that over the phone. So we've got a way to go, and we're playing massive catch up with health.
So which, as it says, you're into health and social care, in which way would you like it to basically go back? I would say it won't go back to normal, but which way are you going to be working on it to get it to a certain degree where it's not making people feel that when they do phone, they're just not getting anywhere, or they just say, oh, can't help you, and that's it?
I think one thing to remember is the way GPs are, their private businesses, so they're private contracts really, and they operate as private businesses. That's not to say that we don't work with them as a local authority, and we do, and we work very closely with GPs. But they are having to play catch up. They have a patient list, a huge patient list. What I'd like to see happen in the future is a really good hybrid mix of people being able to access the Ask My GP, but being able to have face-to-face. I think the problem we've got, there are so many operations that were cancelled. People's health has deteriorated massively. And it might not sound anything if somebody's knee hasn't been replaced. But if somebody has had a knee that's not replaced and they've not been as mobile, they may have put weight on, they may have got more arthritis. So actually there's a massive deterioration in people's health. It's not just the more serious surgeries like cancers or, you know, other types of surgery. There's a whole, if you leave things and delay things, situations do get worse. So there's been some investment from the government, not enough. But do you know what our biggest problem is in health and care? We don't have a workforce that can cope. We need to recruit more doctors, nurses, midwives, mental health nurses. We have a massive issue with workforce, and that's our problem, because you can't knit a nurse. I'm sorry to put it as bluntly as that, but what I mean is it takes training. You have to recruit somebody. You couldn't just magic a workforce overnight. I wish we could, but we can't. So, and we've got a very tired and frazzled workforce. After what they've been through in COVID, they're also really struggling. So we've got a way to go.
Would you visit schools to encourage them to take up health and social care?
Yeah, absolutely. And I think that one of the things I do with this portfolio is that I speak to younger people about what I've done in social care. So a lot of younger people think that social care is just about older people's care homes or personal care. It's not. So I started my career in social care as a drug worker. So I worked in needle exchanges, and then I worked in the prisons, and then I worked in the police custody suites, then I managed mental health teams. So social care is so varied, and what I do when I speak to younger people is say to them, it's a really varied and challenging career. You know, you could support somebody living with a learning disability to enable them to live independently. You could befriend older people to enable them to live independently, or you could go and work in mental health. It's a really varied career, but absolutely right. We need to encourage more people to see health and care as a career, and a career where they can progress.
Is 60 million enough to work with health and social care?
We get a settlement from the government, and then we have to allocate that according to need. There's an element of council tax, the precept, which goes towards social care, so a local authority will generate 3 million. But sometimes it's not about money. It's not enough money, but I think sometimes we can do things more creatively. We have some very old-fashioned models of care, sometimes in health and care, and we could do things differently. For example, if we looked at older people's housing, if we built houses for the future, which meant that they were already adapted for example, wet room or wheelchair access, then you wouldn't need to ask people to move on as they got older in years. There are many more creative ways we could think about keeping people independent at home.
Would you say that we need more respite support for people in Trafford, especially Trafford carers?
I think carers have been so adversely impacted upon with COVID. For example, if you are caring for somebody who's living with dementia and quite advanced dementia, and during COVID all daycare closed, that was it, there was no daycare. So you were at home with a very challenging loved one, and it's really difficult because dementia can manifest itself in so many ways. People can behave quite aggressively, really challenging. And if you're a carer, and a lot of carers are older carers as well, so they're living with their own health issues. And if you can't get access to healthcare, as we've just talked about, you become more unwell yourself. So carers are one of our biggest assets around supporting people. So we do have Trafford Carers, which is commissioned in Trafford, and that provides things like counselling, some of the holistic therapies, befriending and support groups. That's only just starting to get back up and running face to face, because again, we couldn't meet face to face. But you're absolutely right. I think respite is something, sometimes people just think, I need a break. I just need some time for myself, because if you don't get that time for yourself, how are you supposed to invest in your loved one? You just get tired and frazzled. So to the point about Heather made about money, really, I think extra money and resources could go towards things like respite care and supporting people in the communities. For example, things like physio changed, and we're still playing catch up with physiotherapy. Aids in adaptation, so going around making sure anybody has a ramp or a door handle, all of those things changed. We have a massive programme of catch up, which is not going to be easy because of the workforce issue I've just mentioned, but I don't disagree with the points you've raised at all.
People going through rehab sometimes need a temporary blue badge while they recover. Why is it so hard to get these?
It is, this is what we were talking about benefits earlier on. Why do we have to make things so difficult? If we made processes easier, we'd find that more people would access them, and we'd probably keep people healthier and well for longer. So sometimes there are systems which happen at a national level. So the blue badge system is part of a national scheme as well as local, and I did a piece of work for a young woman who was told she couldn't have one, and we appealed it because it was done on ridiculous parameters, and then she did get her blue badge. But we also have to do things in our neighbourhoods which make buildings more accessible. So how do we make sure that streets are safer to walk down, that things are well lit, that our transport links are better? I mean, the good news coming out of Manchester is around buses and an integrated transport system to help people get out and about better. We have to think not just in little boxes about how people age. We've got to think about how we join it together. Housing, parks, streets, transport, communities. It's the big picture stuff that matters, not just thinking about one tiny bit.